Welcome to the first topic, which is cranial nerves. The central nervous system receives information via the afferent fibers. The information are then being processed within the brain or spinal cord. The information that has been processed are sent to target structures such as muscle or glands via the efferent fibers. So in this video, we will be focusing on the afferent pathway of the orbital sensory innervation and its efferent pathway. The afferent pathway of the orbital sensory innervation involves trigeminal nerve, which is cranial nerve number 5. The trigeminal nerve branches begin at the involved structures and join to become larger nerves at the trigeminal ganglion. They can be divided into ophthalmic division, maxillary division, and also mandibular division. The ophthalmic division of trigeminal nerve involves nasociliary nerve, frontal nerve, and lacrimal nerve. Let's take a look at the nasociliary nerve. Nasociliary nerve are formed by the joining of infratrochlear nerve, the anterior and posterior ethmoid nerves, long ciliary nerves, and sensory root of the ciliary ganglion. Frontal nerve are sensory fibers from the skin, muscles of the forehead, the upper eyelid, which join and form the supraorbital nerve and supratrochlear nerve. Next, lacrimal nerve are sensory fibers from the lateral aspect of the upper eyelid and temple area of lacrimal gland. Maxillary division of trigeminal nerve are divided into infraorbital nerve and zygomatic nerve. Infraorbital nerve are sensory fibers from the cheek, upper lip, and lower eyelid. These fibers enter the maxillary bone through the infraorbital foramen. Zygomatic nerve are sensory fibers from lateral aspect of the cheek and lower eyelid foramen. They are formed by the zygomatico-temporal nerve and zygomatico-facial nerve. The sensory fibers from the three divisions join together at the trigeminal ganglion. The sensory root carries information from structures of the face, head, and also all orbital structures. The tract at the brainstem terminates in sensory nucleus of the trigeminal nerve. Next, we will be looking into the efferent pathway, which involves 4 cranial nerves: oculomotor nerve, trochlear nerve, abducens nerve, and lastly facial nerve. Firstly, the oculomotor nerve. Cranial nerve number 3 innervates superior rectus muscle, medial rectus muscle, inferior rectus muscle, inferior oblique muscle, and superior palpebral levator muscles. They also provides a road for autonomic fibers to innervate their own target structures. Trochlear nerve, which is cranial nerve number 4, carries general somatic efferent fibers that exclusively innervate superior oblique muscle. They are also the thinnest of all cranial nerves and has the longest intracranial pathway. Abducens nerve, cranial nerve number 5, innervates the lateral rectus muscle. The nucleus are located near the inferior dorsal midline of the pons. Facial nerve has 2 roots, which the large motor roots innervates facial muscle, while the smaller roots contain sensory and parasympathetic fibers. That's all from me. Thank you.
Visual pathway. Anatomy of visual pathway. It starts from optic nerve to optic chiasma to optic tract to lateral geniculate body to optic radiations and lastly to visual cortex. Next is about arrangement of nerve fibers. Firstly, nerve fibers from retina. Fibers from nasal half come directly to optic disc as SRF and IRF. SAF and IAF is from temporal half. From macular region, pass straight in temporal part of optic as PMB. Next, nerve fibers in optic chiasm. Temporal fibers, it remain uncrossed and runs backwards in lateral part of optic chiasm. Next is nasal peripheral fibers. It is 3/4 of fibers, which upper nasal fibers that transverse chiasm high and posteriorly, while lower nasal fibers transverse chiasm low and anteriorly. Macular fibers in optic chiasm nerve arrangement, where some fibers cross and run backwards while some fibers uncross and runs on the same side. Next, nerve fiber arrangement is in optic tract. It consists macular fibers which occupy dorsolateral aspect and upper peripheral fibers which situated medially in the optic tract. Next in the arrangement is the lateral geniculate body. It consists of macular fibers that coming in the optic tract occupy the posterior 2/3 of the LGB. Next, I'm going to talk about lesion in visual pathway. It is divided into 6 layers of visual pathway, which is optic nerve, optic chiasm, optic tract, lateral geniculate body, LGB, optic radiation, and visual cortex. Firstly, the lesion in the optic nerve. It is characterized by complete blindness on affected side and absence of light reflex on ipsilateral side and consensual on contralateral side. It is caused by traumatic optic avulsion, acute optic neuritis, and optic atrophy. Next is the lesion in the optic chiasm. The first part is the central chiasm lesion. It is bitemporal hemianopia and leads to partial descending optic atrophy. It is caused by pituitary tumors and supracellular aneurysm. Second part is the lateral chiasm lesion. It is binasal hemianopia and leads to partial descending optic atrophy. Next is the lesion in the optic tract. It is incongruous homonymous hemianopia and it is called as Wernicke's reaction, which is contralateral hemianopia papillary reaction. It is caused by syphilitic meningitis or gamma, tuberculosis, and tumor of optic thalamus. Next is the lesion in lateral geniculate body, LGB. It is incongruous homonymous hemianopia, sparing of light reflex, and partial descending optic atrophy. Lesion in the optic radiation. The first one is the involvement of total optic radiation and it is more congruous. And the second one is the involvement of part of optic radiation in temporal lobe, which is called as pie in the sky, and the second one is the pie on the floor. Next part of lesion is in the visual cortex. It is divided into 2 parts, which is anterior occipital cortex, which caused by occlusion of posterior cerebral artery, and the second part is the tip of occipital cortex. It is caused by head injury, gunshot injury involving tip of the cortex.
Hi guys, my name is Nick Ami and I'm going to share about innervation of eye and Adnexa. So this is part of our visual pathway. We begin with optic nerve. Here the optic nerve composed of axon of retinal ganglion cells that are collected in a bundle at the optic disc and emerge from the back of the eye. The pathway that carries the nerve impulse from each eye to the various structure in the brain that analyze these visual signals, especially the primary visual cortex. Next, we move on to the lamina tuberosa. The lamina tuberosa consists of the scleral fiber that pass across the regions where the optic nerve enters the eyeball. Next, the visual pathway will pass through the optic chiasm. The optic nerve of the 2 eyes emerge from their optic disc and intersect at the optic chiasm. At the optic chiasm will occur decussation. What is decussation? Decussation, the exit from the nasal side of each retina cross over in the optic chiasm to the contralateral optic tract, and the axon from the temporal side of the retina remain the same side, which is ipsilateral. After pass through the optic chiasm, the visual pathway will pass the lateral geniculate body or nucleus. LGN is the main relay in the pathway to the primary visual cortex. Content of 6 main layers of the two eye are maintained in separate layer 1 and 2, that we call the magnocellular layer, and the other 4 layers that we call it parvocellular layer. Magnocellular layer receive input mainly from the larger parietal ganglion cells, respond maximally to the stimulation of high temporal frequency and low contact. For parvocellular, mainly receive input from major ganglion cells that display red color with exponential and high spatial acuity. Next part for visual pathway is the optic radiation. Optic radiation are a large white matter tract that contain the essence of the LGN neuron as they pass to the primary visual cortex. Those forming the sublenticular optic radiations carry information about the superior hemifield. Those forming the retrolenticular optic radiation carry information about the inferior hemifield. So this is the last part of the visual pathway. We have the visual cortex. The primary visual cortex is located in the most posterior portion of the brain's occipital lobe on each part of the calcarine fissure within. The analysis of visual stimulation that begins in V1 and V2 continues through two major cortical systems for processing visual information. Ventral pathway involved in recognizing objects, and dorsal pathway essential for locating objects. That's all for visual pathway. Thank you for watching.
Now we move on to the next part, which is motor, sensory and autonomic innervation. So we will be focusing on autonomic nervous system, which controls involuntary response, and it can categorize into two divisions, which is sympathetic division and also parasympathetic division. So for the first one is sympathetic division. This is the drawing of the overview of ocular innervation. Sympathetic is also known as fight or flight response, and in this ocular innervation, it regulates pupil mydrosis, which is a condition where pupil dilates, vasoconstriction of choroidal vessels, widening of palpebral fissure, decrease of lacrimal gland, and regulates production of gland secretion. So parasympathetic is also known as rest and digest response, and it regulates pupil myosis, where it is a condition where pupil constrict, increase in lacrimal gland or lacrimation, and also contraction of ciliary muscles, which cause accommodation. And this diagram shows the overview of ocular innervation for parasympathetic. Next is pupillary light pathway. So this is the diagram shows the pupillary light pathway, and it consists of afferent and efferent pathway. The last one is the disruption of pathway, which involves three pathways. The first one is afferent pathway, second one is central nervous system pathway, and the last one is efferent pathway. The disruption can occur in either retina, optic nerve, optic tract, or optic chiasm. It affects both direct and constitutional response, and the presence of relative afferent pupillary defect or RAPD can be determined by conducting swinging flashlight test. So this picture shows the condition of eye with no light. The second one shows the eye with normal response to light, where the pupil become constrict and small in size. And the third one shows the positive RAPD of right eye, where the pupil remain dilated even though the light is put in front of the eye. Some of the possible causes of RAPD are optic neuritis, retinal detachment, severe macular degeneration, severe glaucoma, which can damage the optic nerve due to trauma, radiation, or tumor,
and also retinal infection due to CMV or herpes. CMV is a cytomegalovirus and herpes is also a virus. Next, for the CNS, this is the midbrain cross-sectional, and the disruption to dorsal tegmental of midbrain can interrupt fibers from pretectal nucleus to oculomotor nucleus, and then it will affect all fibers into endangered vesical nucleus. The disruption causes people to show poor direct and consensual response but constrict with the near response, since fibers carrying near response is from more vertical locations, hence it does not pass the affected midbrain area, which is Agar-Robertson pupil. And the last one is efferent pathway. So that's all for this subtopic. Thank you.
Hello everyone, today we are going to learn about ocular blood supply and also drainage. Stay tuned! Here is the arterial blood supply, which is internal and also external carotid artery. So you have to know that autonomic artery is the major artery in the internal carotid artery. And here are the branches of the ophthalmic artery. Next, we move on to external carotid artery. There are three arteries that have in the external carotid artery, which are facial artery, superficial temporal artery, and also maxillary artery. Next, retinal blood supply and also venous channel. There are 8 venous channels that you have to know. Here are the venous system. Lastly is cavernous sinus.